He's probably a really good singer too.
Yeah, Doc, whenever we get you on, like the lady numbers, they just through the roof. So we're just going to let you guys look at Dr. Hoa for a little bit. Can you flex your pecs, Doc?
Crazy.
He's
You guys
blushing.
okay?
Okay, here we are. Anyway, good morning. It's the link on the breeze 93.9. What up, Sabrina?
What up?
It's all proudly brought to you by First Hawaiian Bank. And just really want to thank First Hawaiian Bank for jumping on. Also, Calvo Enterprises and IT&E, where IT&E is warning you, don't fall, don't get duped.
What?
IT&E was reminding you,
Oh,
don't get duped.
yeah, there was something that was posted. Somebody
Right,
claiming they
yeah.
were IT&E, and it was some sort of contest.
Mm-hmm.
And they're saying that, hey, that's not us. Don't click
Exactly.
the icon. It's not true.
Okay, and then with First Hawaiian Bank, the governor's recent announcement of PCOR 1 banks are considered an essential business. As such, all FHB branches will continue to remain open and offer the complete range of services. The bank continues to take extra precautions daily to sanitize the facilities and will manage the number of customers. Branches open 9 to 4, and the drive-through teller will be open from 8 to 4. Visit First Hawaiian Bank's social media channels or FHB.com for updates to our operations. First Hawaiian Bank, member FDIC. All right, so let's go to the Zoom room where we have Dr. Hoa Nguyen from the Governor's Physicians Advisory Group. Good morning, Doc.
Good morning, guys. Morning.
Our first talk during pandemic condition of readiness 1, Doc. So we haven't talked to you in this new status that we're in. We had 42 positive cases yesterday. We know you're right there on the front line. You know some things. So we'll just go ahead and give you the floor and just tell us where we're at this morning with the COVID-19 response.
We still on PCOR 1 as you expect, just a day one yesterday. And we probably will expect the case to come up the next few days. And then hopefully, if everybody in the community kind of cooperate and kind of stay home and not do the gathering, hopefully by next week, we see the numbers start to come down. It's very important that people really, we need help from everyone in the community to kind of not have any gathering, even in the family, because that's what we see in the last week or so is all this positive is because the gathering, even 10, 12, 15 people gathering the family is a very big risk. So if we can all help each other and don't have the gathering in the family member, maybe we can get out of this thing off of PCOR 1 in 2 weeks. We really need to get out of this PCOR 1. So everyone need to do their part at this point. Like yesterday, we have 2 positive in our clinic, and talk to the patient is all about family member get together and bring it home to your other family in the household goods. So if you can, just stay at home and stay with your family for now, and try not to go to different people's house just because you have no idea where they're coming from.
Doc,
So we need.
when you said you had 2 positives at the clinic yesterday and discussing these results with the patients, finding out they're at the gatherings, they know, right? They know that the gatherings are where it happens. So what's their response when you kind of sit them down and find out how they may have contracted the virus?
The people response always, they very sorry. They know. I mean, everyone know. It's something that every one of us don't think is going to happen to us, but once it happens, it really hit home. And it's detrimental to the family. Because certain family have people in the family have high risk, and so it's just that, like I said, everyone know it's a mistake. Like I said, but we still gonna try to do that, and it's not good. So like I said, I read the letter of the Chamber of Commerce. about the business in Guam, all that kind of stuff. But we can't go through this with the help of everybody. So, really stay home. And, the workplace is okay. The workplace is safe because people wear masks. But I keep asking a question for everyone, my patient. I say that, when did you drop your mask? And they say, well, I drop my mask when I go home and when I hang around my friend. And that's what the risk is. When if you live in the same household good, you stuck. That's your family. But anybody that outside your family household good, you really be careful because that's where the risk is at home. And when you gather with your neighbor, you gather with your extended family, gather with your friends, and we are not so unique. Hawaii had the same thing. They never going up just because they're gathering. And so, for to help us do this thing, you really have to be careful what we do. It's no longer import from people who travel off island because they catch everybody in the Q factor. But now the people in the community need to kind of hunker down and get us through this thing.
All right. Doc, I think when we spoke with you last week, you were mentioning, based on the Physicians Advisory Group meeting, the doctors were recommending we go into PCOR 2 with some aggressive action that needed to be taken. But when we went into the press conference later that morning at 11:30 with the governor, there was the announcement that, nope, we're going into PCOR 1. Do you know, or did you have any discussions with the governor in terms of why she decided that I'm just going to go for PCOR 1 instead of the PCOR 2 recommendation?
The government have a very hard decision to make, and I mean, agree or not agree with her. There's, we have to follow that because she has the ultimate responsibility of the whole island. I think she know very well that economy-wise, it's a big risk for the economy to shut people down, especially the business. But at the same time, as you can see now, the hospital we up to 14 now, and 4 in the ICU, and that trend gonna still coming back up. Hopefully not too much in the next few days. Um, if people are not follow the guideline of social distance and mass and gathering, she had to make a very hard decision of claiming everything down because by shutting down those business, so hopefully people stay home. And like I said, I see more car in the street. I have no idea where people go, but they really need to get our economy up and stay home. And we should have much less car in the street at this point. So, Sabrina Christmas, you gotta pass the word out. I mean, people don't have, if you're not working, stay at home. You can go outside, go to the park and exercise, no problem. But if you go and visit your relative or your family somewhere, you just put your family member at risk at this point.
And we did speak with Lillian Posadas earlier, and it was really, really concerning the discussion we had, because now we're looking at opening a COVID care unit 4. ICU beds are filling up.
Yeah.
I, I
Now
think they
we're
have
looking at ordering Blue Med tents.
uh and if people doesn't pay attention to what we have right now, unfortunately, there's few people out there that still don't believe this thing happened, and they still hang around and they sick. They still go around to the people. So yeah, I mean, we can get to that stage if we not be careful what we do at this point. So I tell you, if you hang around people that you can hear them cough and congest, just tell them go home. And stay away from and respect you. So that way, you don't get sick and bring home to your family. We come up with the flu season in September, and we're going to be a mess. We have just 2 weeks left to get through this thing. I say the governor are well aware of the flu season coming, and we have a few people in the hospital regarding the flu already. So if we don't bite this thing right now and hunker down and get through this hump during the flu season, it's going to be It's very, very hard for everybody. We need to get back to PCOR 2, but in order to do that, everybody need to pay attention and help each other. And I say, stay home. When you're sick, just don't go somewhere. I mean, that's the only thing that when I see patients in the clinic and I know they're sick and I know they're sick, they still go around their friend. I just don't understand that. So, please respect people.
What's on the agenda for tonight's Physicians Advisory Group meeting?
We gotta look at our Q factor. We gotta look at inbound passenger again, to try to see to kind of closes the loop here of the home quarantine. Because we asked public health and quarantine team to give us some statistic to see how many people really follow the home quarantine and do the testing out, if they are staying at home for a full 7 days or not. So we might have to clamp back down again to try to keep the home quarantine that are turning positive in the 7 days mark, to not go around and spread the virus. Remember, you're infectious, at least 2 to 4 days before you start showing symptoms. So if you home quarantine and you go shopping and hang around your friend, you're gonna spread this thing like wildfire. So you really have to stay at home, your home quarantine. So we're gonna look at that program very carefully to see if we need to change that home quarantine to make it a little bit stricter.
Yep.
We need to look at the pre-arrival PCR to rather than 5 days, we might put it back down to 3 days. I know it's inconvenient for people, but we did that to try to kind of relax the thing, and we see the number go up again. So if you come in with a pending PCR that's not ready, I have talked to a few people in public health already. We might put you on Q factor until your PCR is back, and before we release you, we probably test you again before we let you go.
But
just
what
to make
about
sure.
making sure they don't get on a plane until they have their results, so we don't see what happened with that flight from Honolulu last week? I know that when we spoke to JQ, he was saying that, that needs to be done, that you can't get on a plane unless you have a negative test.
Yeah.
Because whoever this person was from DOD came in, and in the air, it's like, oh, damn, I'm positive.
Yeah.
And all
so
92 were quarantined.
Right. And Doc, when you respond to Sabrina's point, could you also just, if you know anything about the status of those 92 people who are quarantined, have any of them tested out or?
The thing that we have the idea of requiring them to have negative PCR to get on the plane, but that's not enforceable. That's the thing. People will get on the plane. They say, I don't have any PCR testing. I still get on the plane. It's not a regulation or rule that we can enforce that. Because unfortunately, you live in a free
But is it
country.
a Department of Defense regulation? Because this was a DOD, somebody connected to the DOD, whether it was a civilian or a military personnel.
Yeah, that patient I know from, is have a pending PCR, but when the plane is positive. But from my understanding, that person is not symptomatic. But again, you could be, an asymptomatic spreader out there, and so they decide, because the situation right now, that they quarantine a home plane. I
Right,
understand
but do you
that.
know if the Department of Defense requires their personnel before they get on a plane to have a negative PCR test?
I think that's what we're going to talk about. There's a lot of people that travel, especially DOD. I know they work with public health very closely, but something that DOD can enforce before a person get on the plane. Now, DOD is different than our civilian. They have the regulation.
Yeah.
And, they can force people to do certain stuff. We as civilian, we cannot really force our patient to have a PCR test that is available before they get on the plane and fly here. So that's a two different ball game. But DOD, I think there's so much regulation out there that they should be negative before they get on the plane. And that's something that we're going to discuss. There's a lot of discussion we're going to do tonight, just to try to clamp down and and help us go through this P-Core 1 to P-Core 2 as soon
Right.
as possible.
Yep. And I got to call out all the people on home quarantine. See, Toka, you're gonna get it now. They're gonna take away the home quarantine because you guys don't know how to keep still. Ketufen, keep still. And I mean, I'm saying it in jest, but it's really serious that. I mean, we've got people who are getting waivers who are running around, people in home quarantine who are breaking the quarantine. I mean, it's so serious that they're going to discuss it tonight in the Physicians Advisory Group. It's so serious that we're seeing this crazy spike in the numbers. Doc, while we're on the subject of DOD, can you shed any light at all about the tests and positive cases that they're running up at the Naval Hospital? Because we had public health on yesterday, and they told us that it was a combination of active duty and local guard dependents. We saw some more tests and more positives run at Naval Hospital yesterday. So, can you just once and for all provide the clarity on this? What are we looking at with these cases that are being tested out of Naval Hospital?
Yeah, just like public health was saying, the Naval Hospital will see active duty, and if you have TRICARE, insurance to the guard member and the dependent, they can see that too. So it's a combination of active duty and guard member and their family. So I know if they test them, most likely through because they're symptomatic or through tracing on their part, that's why you see a high degree of positive. Just because I think that once a family member turned positive, they're going to test the other family member, and more likely, if you're in the same household good, you're going to pick it up. So I think once you see one, you tend to add one or two more, depending how big the family is. So the number can jump pretty high suddenly just because the family household.
Right.
But combination of guard, just remember those people live in our community.
Yeah.
They not live on base. So, that's, but like I say, it's help. If you really, if you feel sick, that you stay home. So those are combination. I don't think they give you a strict number, how many guards or how many active duty.
Yeah. But that's why I wanted to get the clarity from you, Doc, because people see Naval Hospital and they automatically think, oh, Navy, Air Force, and we know that's not the case. And I don't want people. I mean, I don't care if you guys want to hate on the military. That's on you, whatever. But I just don't want people to think that, oh, it's all Air Force, Navy, we got nothing to worry about. No, these are people in the Guard. They're dependents. They live out here with us. We all know somebody in the Guard. So got to take it serious.
No, absolutely. You got to get that out of your mind. It's not active duty. There's Guard member mixed in there. So if I'm going to venture to say that put more Guard members than active duty on that positive list.
Right. Yeah.
When we see the numbers from the Joint Information Center and it says X amount are military, is the Air Force and the Navy required to report their confirmed positive cases? And if so, are those included in the numbers from the Joint Information Center?
Yeah, I think both Navy and Air Force, they work public health, and Anne should be the one that tell you that, but they work very closely because like I say, this member, either active duty or a guard member, they are in the community, so they will comply with public health and tracing and contact and try to figure out who they come in contact with, so they are working together. They will not be isolated and not reporting that thing because, like I say, it's in the community because not all of them live on base. So,
right, but they also conduct from like the Air Force personnel that were staying at the Reef. The Air Force conducted their own contact tracing, isn't that right?
Yeah,
they had their own investigators and.
Have their own investigator, but again, they will have to work with one public health,
Right.
which is outside the gate.
Yeah. So I remember, Bree, what happened was public health did everything on the Reef side, and then they had to work in conjunction with the Air Force. And remember, there was problems with the public health, Annette Uggan and her contact trace team getting that info in a way that she felt was timely enough for them to do the kind of investigation that they needed to do.
Mm-hmm. But when it
We
says,
also,
go ahead.
we also will push public health and make sure that they have adequate staff for tracing. it's very important. I mean, it's a problem not just in Guam. It's a problem everywhere. When you start to multiply this case, through contact, it's going to grow exponentially. From the 10, 20 contact to a 500, 600 contact. I mean, you should have enough people to do that. Know that they try to pull people, from the other agency to try to
Yeah.
help. But we're going to need probably about several hundred of these people if we're going to clamp down and trace all the people that come in contact with a positive one.
Right, Doc. I mean, that's interesting because every time we ask public health about, the status of the contact trace and do they need people, the answer we get is like, oh, no, we're good. We're pulling these people from different divisions of the agency. Man, Doc, I had just a question, a comment here on our Facebook Live feed. There are a couple of hotels still open for business that are not quarantine sites, but are still accepting local walk-ins. Is this allowed?
But which one, Chris?
Hotels allowed to be open and accept customers during PCOR 1?
I think like I say, if you can go to a hotel and you stay in a room, you won't infect anyone. I mean, if you, there's nothing wrong with that. I mean,
Right.
if you go to a hotel, you open a party and you have multiple people there, yes, you'll be reported.
Right.
But if your family want to take a staycation and stay in a hotel, just a different atmosphere than your home, there's nothing wrong with that.
Right.
And they isolate themselves and have some release time. So
Right.
yeah, it's okay.
Okay. Or it could just be that maybe, you want to ensure your home environment's safe and you just go check into a hotel if you're, like we see it with Lillian Posadas, you talk about GMH frontliners. A lot of them are being put up in the hotels while they're working on the COVID response to kind of mitigate the risk of them going back home to their families and possibly exposing their loved ones to the virus.
Yeah, I would agree with that because when you work, I tell you, even our staff in the clinic, I mean, we see sick patients every day.
Yeah.
If someone uncomfortable, they have a high risk member in the family, it's perfectly okay for them to use the hotel just to not expose their family to this risk. You never know. All healthcare providers, all the frontliner, they at risk every day.
Bree, did you have any other questions for the doc?
No, sorry, I was dealing with a situation with remote learning.
Yeah.
Sorry, we had to. Yeah, real
I
talk,
just
Doc.
don't
Bree
want-
got a boy who's remote learning in.
And he's calling right now. Like,
He's calling. You go do you. I got
That's
it.
mom
Yeah.
tech support.
Right, yeah.
sorry about that.
And yeah, like Bree don't even know much about the internet and computers, so you just give the phone to Jason. Jason can handle
So
it.
you,
Yeah.
so you
Yeah,
turn
here,
on
Jay.
Wi-Fi.
Here, Jay, you take this. Patching you through to our IT guy, son. Sorry, Doc. Doc, I mean, anything in closing that you want to add? Because we do have another segment. Thank you for coming on. We love having you on.
Right.
We know that you guys are going to go into that meeting tonight. You're going to make the case, the home quarantine. I mean, it sounds like this is, you guys may pull this option entirely.
Or even the early test out.
Right.
Yeah, we try to get people to go home as soon as possible. So, we're still going to have home quarantine. It's going to be a lot stricter. We're going to make sure that public health contact all the people at the home quarantine. And I tell you, pending PCR will be in a Q factor. There's no exception to that one. We're going to push that very hard. I know cut down from 5 days to 3 days makes some inconvenience because it's not easy to get tests in the state. But at this point, we got to tighten up our border in order to protect ourselves. Like I say, everyone need the help here. We want to get out of PCOR 1 like as soon as possible. I mean, there's no fun to be in PCOR 1. It's hurt a lot of business. It hurts our economy. So, like I said, we're going to do whatever we need to do to get ourselves out of this hole and get back to PCOR 2.
So it could be longer than 2 weeks if people don't get their act together.
We don't get our act together. Yeah. Sabrina, Chris, tell people, please.
We're
everyone,
trying, Doc. We're trying. Trying so hard. I'm so disappointed.
Yeah.
No,
I think you need to be more aggressive in your message.
Yeah.
Yeah.
Everybody, everyone, a child, adult, everybody, we need help on get out this hole. So please stay home. Okay, minimize the contact with your extended family for now, just for 2 weeks, and you can do what you want.
Right.
But we need to get.
Right. Yeah, we just need this virus to stop being a bitch is what we need. And the only way it's going to stop being a bitch is if we do what the hell we got to do. Okay?
Okay, thank you so much.
You're not
See,
gonna
Doc,
get it to say it.
I just toughened up the message for
There
you.
you
'cause,
go. Stop
I mean,
being a bitch. Stay home.
Right. You were you were like P-Core 1 is no fun. That's not as hard as like stop being a bitch.
Stay home.
All right.
He's not gonna say it. You know?
I know he's not
a
going to.
nice
He's too
guy.
classy. It's cool, Doc. Don't say it. We're saying it for you. Okay.
Yeah.
My kids are watching. So.
Yeah. Hey, the governor said it. All right.
Yeah.
You talk to the governor.
There's shirts already out
Yeah.
there.
Okay. Yeah, there's shirts out there.
I know.
Doc,
Who's got
did you
these
see
shirts?
that? Did you get that on WhatsApp? Someone had, what is it? COVID is a bitch or something?
Or no.
There's a shirt out that has the governor's picture.
I'm sorry, this virus is a
I'm
bitch.
sorry, this virus is a bitch. Yeah, it's a direct quote.
Whoever made those shirts, we want one. Come
Yeah,
on
there you
now.
go. Comp. Sponsor.
Hey, give you one.
Thank you, Doc. Thank you so much. Okay. And we'll catch up with you. Maybe I'll shoot you something after the meeting. You let us know what happened.
Okay, be safe.
Be safe.
Yes,
Thank
definitely.
you so much for everything.
Okay. Thanks,
Bye.
Doc.
Bye.
Wash your hands. Stay home! Good morning, guys. It's 9:15. Hey, we got a whole KUM News Decision 2020